Good morning. It's my pleasure to introduce Dr. Buschini, who has been gracious enough to allow me to interview her to provide insight into the role of nurse leaders in education. Dr. Buschini, would you please introduce yourself and tell us what your current position and title are?
Well, good morning. Thank you for allowing me to do this. My name is Laurie Buschini. I am a board certified adult nurse practitioner by training and now serve as clinical assistant professor of nursing, as well as the assistant director for NP programs for Jacksonville University.
Thank you. How long have you been in this role?
I taught actually for as adjunct a bit before starting full time, which was in 2019. So I'm still kind of a youngin' when it comes to my role in the academic world.
And why did you choose to be a nurse practitioner?
Actually, not the most inspiring story, I'll be honest. I always thought I would go into med school. My dad was a physician, my mom a nurse. So I don't know that I knew of any other career options other than healthcare. Um, but I started to kind of question the work-life balance. So I decided on nursing for kind of that reason. And I was in my BSN program. This was in the 90s, where we didn't have as nearly the number of nurse practitioners then. Of course, they were naturally around, but not like they are now. And I ended up doing like the capstone project or whatever it was called for my degree. And I did that on advanced practice nursing. So at the time, I had really no idea about it, but it was through that project I became pretty intrigued by the role of the nurse practitioner, where I could practice at an advanced level, still approaching care from like a holistic perspective. And so I guess the rest is history.
That's an interesting journey.
Yes.
What led you to pursue a DNP degree?
I guess the talk had started about requiring a doctorate degree as entry level for NPs. So at that point, I would say I was only mildly intrigued or interested at best. The as I think anyone watching this knows that once you finish a advanced degree, you just want to breathe and sleep for a little while and enjoy, the fruits of your labor. Um, but as time passed, landscape started to change a bit where I worked as an NP. And so, of course, I became a little bit more interested. I wanted to keep my options open. And of course, having a terminal degree allowed for that. Um, and I knew that I wanted to teach, at least at some point. I didn't know when, I wasn't sure when I wanted to at least completely or at least full time come out of clinical practice. Um, but I also knew that it would probably never be the perfect time, to do it, to go back to school, that is. So at that point, I just went for it.
So that kind of leads me into my next question. I was wondering if there's a specific moment or event that you can think of that led you to want to become an educator.
Um, I don't know that there was anything specific. I think we as nurses are educators. I think it's in our DNA, how we operate, even if we don't readily recognize it as such. Um, I know for me, I love seeing that light bulb go on where someone just kind of gets it. They start putting things together, it clicks, it makes sense, that type of thing. So I suppose those are kind of the moments collectively that led me to want to educate as a career. So not really one moment or a thing, but rather like a collection of those kinds of moments that motivated me.
Nursing education is a critical aspect of the future of nursing, and there's a need for nursing educators not only here in Florida, but across the country. The Florida Center for Nursing survey of nursing education programs in our state identified a need for nursing faculty among all nursing program types. So, as a leader in nursing education, what is the significance of a lack of nursing faculty?
Well, ultimately, I guess the education of our nurses falls to less experienced providers, less experienced educators to teach, which has, the potential drawbacks. Or it just doesn't happen. Programs are cut, admissions, and thus graduates decline, which leads to ongoing shortages, which I think we're all aware of and feel pretty strongly. Now, of course, that shortage, that can be outright shortages, like we don't have enough warm bodies, or that may also look like not as many well-prepared nurses, but neither of which are good outcomes. So I would say it's pretty significant, to say the least.
In your opinion, how does a career in nursing education benefit the future of nursing?
I think it brings life experience, obviously patient care experience to the classroom, which ultimately influences the quality of healthcare. I think nurses teaching nurses help preserve kind of what makes our profession so special. Whether it's our love for a holistic approach, our natural desire to educate, prevent disease, our understanding of evidence-based practice. When we as nurses raise up other nurses at really any degree level, we pass along the love and the knowledge of these things, which ultimately preserves another generation of amazing providers in the healthcare team. And that all starts with nurses choosing to share their education and their knowledge as educators.
Thank you for sharing that. Can you describe a time where you felt your role as an educator made a difference to the field of nursing?
Um, I don't know that I can, to be honest, at least not something specific. What I hope, however, is that every student I teach takes at least a pearl of wisdom I share, and over time, that helps to shape them as providers. Which, that in and of itself has a far-reaching effect, or at least potentially can, impacting many lives, in a positive light, whether it be the nurse themselves, their colleagues, and of course, patients. And for me, I can't think of a better way to contribute to the field, than that, to be able to potentially impact others, maybe in a small but meaningful way that can have a ripple effect, if you will.
Nursing educators can have an impact on a personal level, but in your opinion, what role can nurse leaders in education have in shaping state as well as national policy?
I think a great first step is to teach not to be fearful of policy. Um, we all can contribute, even if you don't think of yourself as like the policy type. Um, I see it as almost like a spectrum of sorts. There are those in nursing education that thrive in the world of policy, and they can then light a fire in students who discover that they too share that passion. Um, Now, the other end of that spectrum are those who think of themselves or view themselves strictly as clinical. Um, but they too can support policy, even if it's financially through backing a nursing association, joining those even as a student, going forward and continuing annual dues as a provider, um, staying abreast of current topics. And sometimes you get that nudge to write a letter or have your voice heard to a representative, and engage in that kind of thing. But I think we can all play a part, and it all adds up. I guess it's like crowdfunding, just for policy.
Well, thank you for your time and for providing your insights of how nursing educators contribute to the future of nursing. You
Absolutely.
play an active role throughout the span of the nurse practitioner program at Jacksonville University, from health assessment in the three Ps through the final clinical course or practicum semester. What advice do you have for graduate nursing students to help them be successful in their programs?
Mm. I think that's probably the easiest question to answer. I think it's recognizing that humility is your friend. Being humble keeps us teachable, keeps us in a posture of lifelong learning. We recognize we don't know it all, which allows us to stay curious, to ask questions, and to continue to expand our knowledge. I know that some may view humility as a weakness. They kind of want to puff out their chest and have this air of confidence. But it's actually humility that breeds confidence and strength, because it fosters ongoing knowledge, and knowledge is power. And another tip for success is to please check your school email every day. Like, really, please do that.
Well, thank you so much, Dr. Buschini, for this interview.
Thank you very much.
Thank you. Bye.